Hello, this is Jane Coombs of workingwellsolutions.com, and today I'm going to talk through what it is to be an occupational health nurse, especially if you're considering that as a career. Occupational health comes under public health now. It never used to. When I started, we were very much a treatment service, very reactive, but now we're much more proactive, so we're meant to be into prevention, protection and promotion of health, the 3 Ps of public health. In order to get to the top in occupational health and to become an expert, then you need to go through these steps. So you qualify and register as a nurse, doing the normal nurse training. So you're a registered general nurse, an RGN, and then you decide to specialise. Now you can either get experience of working in industry or with a company first and then go for the academic qualification, or you can do it the other way around. Or just work without getting the qualification at all. So you don't have to get this extra qualification in occupational health. Although some jobs, especially the more corporate level jobs, ask for nurses to be on part 3 of the NMC register, Nursing Midwifery Council register, which gives you that added qualification. When you don't work in the NHS, then you have to think more about professional accountability than if you do, because you're on your own. You're out there in an industry maybe that doesn't understand a nurse's standpoint or principles, ethics, confidentiality. So it's more difficult to sometimes maintain this accountability. You also think about liabilities which fall squarely on your shoulders rather than to an overall organisational head. And insurances are really important, so public liability insurance and professional indemnity insurance is important too. But even if you run your own company, even if you work on your own, you're not actually working on your own, because you have to deal with all these people in order to deal with the patients, clients, whatever you want to call them, or with the people that work and the ones that you're dealing with on a public health platform. So you've got doctors. Doctors will be there to provide clinical governance for the work that you do. Even if you work alone, you have to have a specialist doctor to oversee your work and the quality of it. Technicians can come in to do the mundane, everyday work, like doing lung function testing and hearing testing, and takes an awful lot of the everyday work off your shoulders. Hygienists come into factories and manufacturing, and they take physical measurements such as sound levels, dust levels, chemical levels, all sorts of things. So they are hygienists. And part of their service is they give recommendation to management about how to control the health risks from work, which is what you're dealing with as well. So you work very closely with them if the company brings in a hygienist, especially if you've got a substance which is hazardous to health. GPs, you write to GPs, you liaise with GPs, you get fit notes from GPs. And it's a two-way process, because sometimes you have to write to GPs and tell them what's happening at work as well, because they sometimes don't know. Specialists, you write for reports. Safety, you can sometimes be under a safety umbrella or HR umbrella. Personally, I've been mostly under HR, but I've been under safety. But I'm also safety qualified as well, so it's not so important for me. Employee assistant programs, you're usually their liaison person, referring people for counselling. Trade unions, a huge impact on occupational health. They're very much on your side, and the workers' side try to get things done for the workers to protect them. And of course the other side of it is lawyers and insurers. They will always be watching to see what you're doing and making sure that everything's safe. HR, as already mentioned, huge impact on occupational health. Much of the work that we do is with HR, but the most important by far is the managers. You're acting on their behalf to sort out health issues for them because they don't understand it, and you write reports and send recommendations back to managers. So an important link there. The industry bodies is SEQUOS, is Safe, Effective, Quality Occupational Health Services. This is the accreditation service for occupational health. IOSH, the Institute of Safety and Health, and the HSE, the Health and Safety Executive, where you find most of the information about substances, different workplaces, different work hazards, that sort of thing. So you need industry background, and for occupational health it's quite interesting that no two places are the same and will have the same hazards, risks and work. So for example, construction, I've worked in quite a lot, is far different to the NHS, and manufacturing is very different, say, to a call centre. I've worked in all of these types of places. So you need to know what the hazards, risks and work differences are in your particular company. But not only in your company, it can vary from site to site. I worked in a national food company, and each site was making different things, and they had totally different outlooks and culture. The culture of what was good, what was bad, what they should do, what they shouldn't. So to do that, to know what the culture is, you have to talk to people, but also go out on site, see what the processes are, see what the practices are, how strictly they keep to the rules, and also benchmark and networking. And you can do that through Facebook groups and also JISC mail, and also attending conferences. The important thing about occupational health, I believe, and this may be because of my safety background, is all the legislation that governs the industries outside of the NHS that you need to know about. So we're looking at the Health and Safety at Work Act. That's an umbrella act where you get lots of regulations coming out. So the most important, I believe, are the management regulations that talk about risk assessment, first aid. Usually you're in charge of first aid arrangements, not actually first aid itself, but developing the first aid service. COSH, the control of substances hazardous to health. This is where the hygienists come in. They will look to see the levels of substances hazardous to health. And RIDDOR, the reporting of injuries, diseases, dangerous occurrence regulations, which is quite a mouthful. Not many people know what it stands for. It's generally spoken of as RIDDOR, but if there's an incident, then you have to report it to the Health and Safety Executive. They're the sort of police of factories or manufacturing sites or services. The Equality Act 2010, very important. We're looking at removing obstacles for people coming into the workplace and getting them back to work if they're on long-term sick or disability issues. Very important set of regulations there. And then specific guidance, so the approved code of practices on various things like personal protective equipment or COSH, for example, and industry guidance. So the leaders in the industry generally make their own guidance as well, like the electricity industry or the gas industry. So you need to know the health issues and the knowledge of work, and they divide up nicely into 5 areas of biological risks. So in the NHS, occupational health, you'd be looking at vaccination. For chemical risks, you're looking at any substance that are used, any solvents, any cleaners, and then environmental or mechanical. Environmental issues, you're looking at air quality, and mechanical, you're looking at drivers, things like that. And physical, you're looking at light, sound, vibration, and something very much on the increase at the moment, and have been for the past 2 years or so, is the psychosocial issues of mental health, suicide, stress at work, those sorts of things. So what's the detail of your work on a day-to-day basis? Well, it's about case management. You're going to get clients or patients or workers who have got long-term health issues, off sick, and you'll be dealing with those from the beginning to the end, whether you get back to work and they're fit, or whether they have to leave the company or maybe be redeployed to a different job, looking at what's safe for them to do. Workplace health issues, of course, and you'll be working with all those other people we talked about, but you may find that a group of workers start to come in with, say, a problem with their eyes or a problem with their hands or skin problems, and you will identify a group of workers that perhaps need more control measures. And then regulatory and legislative, I've already spoken about that, but it's knowing the regulations for your particular industry you're working at the time. Something you do a lot of is management and administration. Of course, you have to write up patients' notes like you would in the NHS, but there's a lot more administration. And for the larger occupational health departments, they do have admin teams to help make the appointments, write the reports. And of course, part of the public health is health promotion and disease prevention. So you may be asked to run health promotion programs, well-being programs, stop smoking, lose weight, or there may be an issue that you identify that would benefit from a health promotion program. For example, I recently worked in a distribution centre and the drivers seemed quite unhealthy. The problem is that they couldn't take food with them all the time, and it's very difficult to stop at a shop and buy a healthy snack. Consequently, they ate in cafes, and most of them were overweight and didn't feel very healthy. So we started a program for them, and it was highly successful because the drivers were involved, and they got the children of the drivers involved as well, making calendars and encouraging their fathers to, and they were mainly men, to stick to the rules about healthy eating and smoking. At all times, being an occupational health person, you have to be professional, and sometimes that can be quite difficult when you're surrounded by people, your colleagues, and you're trying to keep issues confidential, and that's pretty difficult. And professionalism also covers being on time, producing reports on time, and being consistent. I think occupational health is very good. It makes you more of a doctor, if you like. You're very much on your own. But you do need some qualities if you're going to run your own OH business or be self-employed. You have to be good at marketing yourselves, and I don't think we're very good at that. You like making your own decisions. Some people don't. Some people like to think about things, discuss things with others, and you can do all of that, but you do need to make your own decisions, and you have to be assertive about it and not aggressive. You need to know the value of your work and not be afraid to charge for it, and that comes into the good at marketing yourselves as well. You need to be friendly and approachable, especially in a business. If you're strict and inflexible, the people of the company tend not to like you, and it can be the end. So friendly and approachable, although not very PC at the moment, is very important if you want to run your own business or be self-employed. You also have to be confident, and that means being able to say I don't know or I'll look it up without breaking confidentiality. And you can be flexible as well. Although there are rules in the regulations and risk assessment, and sometimes you can negotiate a solution with both the employee who you're seeing or dealing with and the manager. So there is some flexibility because you don't know, and if you can meet him halfway or her halfway, then that's going to help everybody. And finally, the other thing I would say is be a completer finisher. I've worked with a lot of people, not just in occupational health, but in other industries as well, that say they're going to do something and they don't. And that links into being professional, and you need to. So that's my very brief rundown of occupational health nursing. I hope you found that interesting. If you'd like more information, do drop me a line at jane.coombs@workingwellsolutions.com. Sign up for my newsletter, which is meant to be regular, but it isn't, I'm afraid. It's very sporadic. I only send out a newsletter when I've got something interesting to say or something to give away. And if you like this video, do give me a thumbs up. It would really help me. Thank you very much. Goodbye.